Hey there, this is Dr. Evan Osar. Welcome to this edition of Integrative Movement Insider. Happy Tuesday. Hope you're having a great day, a great start to your week. We're having some nice weather here just before it's about to get a bit colder here in the Midwest. Today we're discussing the 3 best exercises for your older clients for improving hip extension. And we know that hip extension is so important because think about walking. Walking is part of the gait cycle is all about hip extension. So we know our clients need more hip extension. Obviously, going from sitting to standing, your clients need strong hip extensors. Now, a couple things that we need to sort of recognize before we discuss the best exercises. So number 1, obviously, this is the hip joint. Femoral head sitting in the acetabulum. Generally speaking, just to simplify it, the femoral head should stay relatively well centered in the acetabulum. So that means when you're going through flexion, extension, abduction, adduction, and rotation, or the pelvis is moving around the femoral head should stay relatively well centered within the acetabulum. Hello, my friend Rahul, part of our Integrative Movement Specialist community, as well as Jackie Bachmeyer, part of our Integrative Movement Specialist, and my good friend down in Houston, Texas. So if we think about this, again, regardless of the movement pattern our client is doing, whether they're doing squatting, lunging, walking, bending, we want to maintain that femoral head relatively centered in the acetabulum. We want the pelvis to be in our client's most neutral position. That will be different for different clients based upon their medical history. So our younger clients, we would like to see them and have them relatively in a bit more anterior pelvic tilted position. Again, more of this position because that also sets the hip joint up in the most optimal position, and it also allows the hip extensors to do what they need to do to load appropriately during their exercises. Now, most of our older clients, however, they're not in anterior pelvic tilted positions, and they shouldn't be, relatively speaking, in anterior pelvic tilted positions because of spinal stenosis. Spinal stenosis is a narrowing of the spinal canal, which will cause your older clients to then start to adopt more of a posterior pelvic tilt. Now, that's important to understand because it's also important to recognize then how we determine and train our exercise patterns. Because if you do this with me, if you go into posterior pelvic tilted position like many of our older clients are in, and then take a step forward with your left leg and feel how far you can go into hip extension on your right side. Actually, you can't really go that very far if you've gone into a posterior pelvic tilt because you've already wound up or lengthened the hip flexors, so there's not a whole bunch of room to move into hip extension. Now, if you actually relax your pelvis, and again, this is relative to your own body, and now take a step, now there's more range of motion because you've given your body the ability to go from anterior pelvic tilt to posterior pelvic tilt for hip extension, okay? Now that's not exactly how it moves, but just to give you that sort of relationship between pelvis motion and hip extension. Now, if we live our lives, if your clients live their lives in posterior pelvic tilt, then they've overstretched their hip flexors and shortened their hip extensors. They will not be able to use their glutes appropriately when they're in this chronic position. So that's why if you look at your client's gluteal mass, okay, if you look at the back side, you'll see that very few older clients have a lot of gluteal mass, muscle mass that is. They may have gluteal mass, but it's not muscle mass because they will atrophy these muscles when they can't do one specific action. And that is be able to hip hinge to eccentrically lengthen the glutes and posterior hip complex. Because when you're stuck in posterior pelvic tilt, like most of our older clients are, and they sit for most of their day, which most of them do, well, then you're not going to be able to do, generally speaking, great anterior pelvic rotation. So again, when we think about our clients and balance, well, one of the things that glutes have to do is when you step, the glute maximus really is decelerating the forward swing of the leg, so it's most active right when your heel contacts the ground and as you move towards single leg stance. Then after that, the glute max actually is quite not really working so much. It's quite quiet and it's activity. So one of the things we want to do is look at some of our exercises and are they doing what we want them to do? So number one rule when you're working with the glutes and determining your glute exercises is it training your client to actually lengthen appropriately and not overly contract the glutes. Because if you go with me here, like a lot of people are teaching in our industry, okay, they're teaching when you come up from your squat to squeeze your glute and tuck into posterior pelvic tilt, or come up from your deadlift and do the exact same thing. And if you look, it just drives me into further posterior pelvic tilted position. Again, that's not an issue if you did it a few times or with very low loads, but these people are recommending it during hip thruster exercises, which is one of the exercises that I think will destroy and is destroying more people's hips than almost any other exercises. The conventional deadlift, when you're being taught to come up and then drive the pelvis under, especially when the thorax goes behind the pelvis, because we're not respecting the relationship and where the hip joint should be loaded. If we think about the hip joint, the load should be coming down through the top here. The more that you bring the load, you jam the femoral head forward in the acetabulum, the more the load starts to come through the anterior portion of the anterior and superior portion of the femoral head. And that's why when you look at x-rays, degenerative joint disease, x-rays of hips that have degenerative joint disease, you'll see more of the wear and tear on the superior and anterior surfaces. So again, it's just showing you that that's not the portion of the hip that should be overloaded, and when it is, that portion will degenerate. So we want to teach our clients how to get into the best position. The first thing we have to do is release the posterior hip complex and lengthen the hamstrings for a lot of our older clients so they can actually get into the first exercise. The best exercise for improving glutes is the hip hinge. It's teaching your clients how to align their cylinder to the best of their ability and then rotate that entire cylinder over top the femoral heads. So the hip hinge is the best, number one, best exercise for our older clients because it teaches them how to eccentrically lengthen the glutes and hamstrings and allows them to learn how to move the entire cylinder over top the femoral head. So number one is teaching your clients how to hip hinge with body weight, and then you can load that pattern up. It is not about teaching your clients how to push back, because a lot of your older clients can push back, but they never get into anterior pelvic rotation as I'm demonstrating here. My pelvis is actually posterior. Posterior here, posterior here. We want to make sure that we align and then go anterior. The first motion when you do squat and or hip hinge is anterior rotation. It shouldn't be pushing the pelvis back. Okay, number one, hip hinge. Now the second best hip extension exercise, if you had a sled, that would actually be right up there for us as the second best exercise. However, many people don't have a sled. So again, it's not one of the best exercises if you don't have a sled. So you have to do something that allows your clients to learn how to propel their body forward using their glutes. So our second exercise that we'll teach our clients is the split squat. Because the split squat will also lead into our third exercise. But the split squat is, again, the same idea of stacking the cylinder, hands on the pelvis, and then when you go into a split squat, one leg goes back, maintain that alignment of your cylinder on top of that forward leg. Again, that first motion, hinge. Get that hip hinge to eccentrically load that posterior hip complex, and then drive up from that forward leg without going into that posterior tilted position. Just come up because you're already hip extending and feel as if you're driving yourself forward, okay? So it's load, should feel in that forward hip, and then drive up as if you're moving forward. If you're watching your client from behind as well as the side, their pelvis should stay level. So you should not see their pelvis kick out to the side here. That's not loading the glutes appropriately or the hips appropriately. Load, then drive up as if you're moving forward. Again, that's a great way to teach your client how to eccentrically load and use that eccentric load to drive up and forward. Number two is the split squat. Now, if your clients have knee issues and that's not a great exercise for them, then just turn that into a split hinge. So rather than bending the knee, it's the same idea, just do the split hinge position. Still training relatively that single leg or that forward leg, loading that forward leg. So an alternative for your clients that maybe have knee problems where a split squat isn't a great pattern for them. The third final exercise is a step up. The step up is a great pattern because it really teaches the client how to use those mechanics. Many of our clients have stairs in their house. They have stairs that they need to navigate through everyday life, curbs, things like that. So the step up is really just a progression from the split stance or split squat pattern. Again, if you look at EMG activity, and again, I don't put too much stock in EMG activity, here's why. Because EMG just shows you how much activity a muscle has. It doesn't show you if the client is actually maintaining alignment and control during the exercise. It just shows, hey, is this muscle firing, and how hard or how well or how maximal is this muscle firing? So it doesn't tell us about the quality of the movement. It just says, is the person using this muscle a lot? So what's cool about the step up is that step up actually shows a lot of EMG activity of the glute max, because again, the step up becomes basically a hip extension, a pure hip extension pattern. I don't have a step here, so I'll just mimic. So if my front foot is on that step, it's really the same pattern as a split squat. The foot's elevated, again, maintaining that alignment, and then it's just coming down and then stepping up onto the step and then coming back down to reload onto that forward leg. 3 great patterns, 3 easy patterns: hip hinge, split squat and or split hinge, and then a step up pattern or some variation of that pattern. If you have a sled, use a sled. Sleds are awesome. If you have your own facility, save up, invest in a sled. Those are some of the best patterns to teach your client how to get pure hip extension against some resistance. A couple patterns we play around with not having splits or not having a sled is you can just tie a resistance band and then have your client just step out and focus on using this leg to push versus like just using body weight, have them push out against the band to create some hip extension of that back leg. So simple, easy patterns to help your clients improve hip extension, because ultimately we want to help our clients use their glutes more efficiently, use a hip complex. That's really what it's about. It's not just about the glutes. It's about using the hip complex more efficiently so they have better posture, which leads into better balance, which leads into better walking and a better quality of life. And that's how you become that specialist for your current clients and help more individuals, older folks, improve the quality of their life so they can live independently, live confidently, and do the things they need to, want to, and love to do. So hope you enjoyed this video. Thanks so much for watching. Thanks for being part of our community and for everything you do. If you're looking for more information about anatomy, as well as assessment and corrective exercise around the hip complex, check out 2 Anatomy Geeks. Jill and I have put together the series. We did a whole entire series on the hip, the extensors, the abductors, the adductors, the rotators. We'll really give you a complete look at the hip complex. $69 for about 5 to 6 hours of information, CCs, as well as knowledge that you can apply right away. Because it was very important to us when we created this series that we are giving you knowledge that you can use. It's not just like, okay, here's some muscles, here's what they do, here's where they are, good luck, have a nice life. No, it's like, we want you to use this information. So we show you the information and then how it applies to your clients, how it applies to why so many of your clients, older clients, have hip problems, and then more importantly, how do you use this information to help so many of your clients, because our older clients need us more than ever than right now, right? We know that. So check out 2 Anatomy Geeks hip series, 3 modules. So again, it's all online. You have access to it for as long as we exist, and you get CCs when you do the quizzes. If you don't want to do the quizzes, no, you don't need CCs, no problem. Just use the information, apply the information, and you'll see a big change. And then let us know. Let us know what you noticed in your clients. Thanks so much for watching. Thanks for being part of our community. The link is below or next to this video, wherever you're watching it. And we look forward to seeing you in the 2 Anatomy Geeks community. Make it a great day. This is Dr. Evan Osar with Integrative Movement Insider. Be the leader for your clients, and let's go transform the world. Thanks.